Okay, this is your lecture on anxiety and trauma-related disorders. There's a lot going on in this chapter, and so I really can't even begin to cover everything, but what I want to focus on is three different things. The first is how we separate regular distress anxiety from disordered anxiety, the different types of anxiety disorders and how they're similar, and then a few components in terms of the trauma-related disorders that I think is important. So let's start with how we separate regular anxiety that everybody has, distress that everybody has, from disordered anxiety. And the first one is really functional impairment. Functional impairment is really about how does it impair, how does it mess up your life. So all of us have anxiety, different times of our life we have more anxiety, finals week, that sort of thing, big tests coming up, graduation is anxiety provoking, that kind of thing. But what we really want to look for is this anxiety causing you to change your life in some way? Are you making decisions based upon the amount of anxiety that you have? Life choices in terms of your career, choices in terms of where you go or who you go with, that kind of thing. And so you'll see that come up in the different types of anxiety. But really, how does it impair your life is really important in separating out regular from abnormal. The second one is developmental age. This is particularly important when we think about childhood anxiety, because most children will have anxiety about certain things at certain times of their life. It's normal for children to be afraid of storms, for example. It might not be so normal for an adult to be afraid of a regular old thunderstorm unless there's something sort of connected to it, and then we might be talking about trauma-related stuff. So age really makes a difference when we're looking at anxiety and particularly fears or phobias. And number three is your culture. What is normal, quote unquote, for your culture or your gender or your geographic area? So for example, lots of people are scared of spiders, but do you not go outside because you're afraid a tarantula is going to attack you? If you live in Iowa, that might be disordered because there's not a lot of tarantulas just roaming free in Iowa. But if you live in the Amazon, well, then that's normal. That's probably normal anxiety and normal fears. So culture really makes a difference. Another great example is, let's pretend like you're walking to your car and it's late at night and maybe it's a parking garage or something, so you're not quite sure, there's a lot of shadows. Are you afraid? If you're a woman, you probably are, and this is completely normal because that's what we're taught based upon our gender, based upon our culture. If you're a man, you might be a little bit, but not so much, because there are differences in terms of our gender based on the culture we live in. So these are the three things we use to separate out distress from disorder. All right, the types of anxiety disorders, there's actually 7 different types. I'm not going to go over how we classify them, but I'm going to make sure that you understand what they are. So GAD is generalized anxiety disorder. It's really based upon this idea of multiple worries over a long period of time. There's panic disorder. Panic disorder, the key here is that you have panic attacks, which is actually somewhat normal, but you're afraid of getting another one, and you change your life based on this fear of getting another panic attack. Agoraphobia is specific to this idea of leaving your house, and usually it's tied to this idea of panic attacks. Agoraphobia and panic disorder tend to go hand in hand. There are specific phobias, so you are specifically afraid of something, and there are different types of phobias. You can look that up in the book. There is social anxiety disorder, which actually used to be a specific phobia, and it's now its own disorder. This is related to this idea of criticism or people rejecting you, and so you're kind of afraid of those kinds of things, afraid of speaking in front of others, etc. There is 2 that are what we call childhood disorders: selective mutism, where the child doesn't speak in public, but not because they have problems speaking, simply because they're afraid to, and separation anxiety disorder, where the children are afraid of being separated from their caretakers. So the thing that sort of connects these is that this is, there's some anxiety in some kind. Most of them, the anxiety has to last for at least 6 months, with the exception of panic disorder, where it's 1 month. And the way that we treat all of these is the same. We treat them through exposure. And the book goes a little bit deeper into that. Now, trauma-related disorders, we're going to really only talk about 2. PTSD, which is the big one, and then acute stress disorder. which is kind of a milder form of it. And the way we separate them in many ways is actually based upon time. That's my time limit, but I want to point out really quickly that PTSD, you must have the symptoms of PTSD for at least 1 month following the event that caused the PTSD. So somebody cannot be diagnosed with PTSD the day after they witness a traumatic event. The things that they're experiencing, the symptoms they have, are just normal reactions. 1 month after the event, they have to still have all of those reactions. Acute stress disorder is the in-between. It can be diagnosed after 3 days. So the event happens, 3 days later you can diagnose acute stress disorder until you get to 30 days. Once you pass 30 days, you're at that 1 month and you're probably at PTSD. So a key component here with these trauma-related disorders is length of time. You cannot diagnose them right away. When you have a trauma, those symptoms are considered normal. It's long-term, after the trauma has occurred, you're still having those intense, severe symptoms. All right, that is the anxiety and trauma-related chapters.